Narrowband imaging versus Lugol chromoendoscopy for esophageal squamous cell cancer screening in normal endoscopic practice. Randomized controlled trial. Introduction. Esophageal squamous cell carcinoma, SCC, is a frequent and severe disease that is associated with a high mortality rate. Prognosis is related to disease stage at the time of diagnosis and is considerably better for superficial carcinoma. For example, intramucosal SCCs are curable using endoscopic resection, which avoids the morbidity and mortality associated with esophageal surgery. Thus, early screening of superficial SCC is crucial to improve prognosis. Patients with previous history of upper aerodigestive tract SCC, in particular ear, nose, and throat or esophageal SCC, have the highest risk of both metachronous and synchronous SCC in the whole upper aerodigestive tract. In such patients, the European, American, and French gastrointestinal GI endoscopy societies recommend upper GI endoscopy screening with esophageal chromoendoscopy. Historically, the reference technique has been Lugol chromoendoscopy. Although this technique is highly sensitive, its specificity is low, as demonstrated in several studies. Furthermore, Lugol chromoendoscopy leads to esophageal spasms, is sometimes painful, and is time-consuming, resulting in infrequent use of Lugol staining by gastroenterologists for the screening of SCC, approximately 15% of screenings only. An alternative modality is narrowband imaging, NBI, which is based on the use of selected wavelengths of light and has demonstrated high sensitivity and specificity to detect superficial SCC when performed by experts. This technique is now recommended alongside Lugol chromoendoscopy for esophageal screening in European Society of Gastrointestinal Endoscopy, ESGE guidelines. The sensitivity of NBI and Lugol chromoendoscopy is almost 100% in both modalities, and the non-inferiority or even the superiority of NBI over Lugol chromoendoscopy in terms of specificity has been reported, but only in expert endoscopy centers. Nevertheless, the authors state that to the best of their knowledge, only one study, reported by Ishihara et al., has compared the diagnostic characteristics of NBI according to the level of expertise. The authors found that results from expert centers might not be reproducible in non-expert settings. The present study therefore aimed to compare the two techniques of chromoendoscopy in a nationwide randomized study involving expert and non-expert centers to screen esophageal SCC in patients with a history or current SCC in the aerodigestive tract. The study aimed to demonstrate the superior specificity of NBI compared with Lugol chromoendoscopy to detect esophageal SCC and high-grade dysplasia, HGD, in current practice, including tertiary care centers, local hospitals, and private clinics. Background. NBI is as sensitive as Lugol chromoendoscopy to detect esophageal SCC, but its specificity, which appears higher than that of Lugol chromoendoscopy in expert centers, remains to be established in general practice. This study aimed to prove the superiority of NBI specificity over Lugol chromoendoscopy in the detection of esophageal SCC and HGD in current general practice, including tertiary care centers, local hospitals, and private clinics. Methods. This prospective randomized multicenter trial included consecutive patients with previous or current SCC of the upper aerodigestive tract who were scheduled for gastroscopy. Patients were randomly allocated to either the Lugol or NBI group. In the Lugol group, examination with white light and Lugol chromoendoscopy were successively performed. In the NBI group, NBI examination was performed after white light endoscopy. The authors compared the diagnostic characteristics of NBI and Lugol chromoendoscopy in a per-patient analysis. Results. 334 patients with a history of SCC were included and analyzed, intention to treat, from 15 French institutions between March 2011 and December 2015. In per-patient analysis, sensitivity, specificity, positive and negative likelihood values were 100%, 66.0%, 21.2%, and 100% respectively for Lugol chromoendoscopy versus 100%, 79.9%, 37.5% and 100% respectively for NBI. Specificity was greater with NBI than with Lugol. Conclusion. As previously demonstrated in expert centers, NBI was more specific than Lugol in current gastroenterology practice for the detection of early SCC, but combined approaches with both NBI and Lugol could improve the detection of squamous neoplasia.